everyone, I'm Ashley Ryder, and today we're going to be going through the crucial steps necessary to perform a serratus anterior plane block. First of all, it's important to review the imaging associated with your patient's injury. This patient unfortunately has fallen off a ladder and is complaining of right-sided rib cage pain. So I'm going to go over, review the imaging from the X-ray and CT, and confirm that they are indeed lateral rib fractures on the right side. This is important because posterior rib fractures are not going to be helped as much by this block, nor are very anterior rib fractures. You have 3 rib fractures on the right side.
Okay.
Fortunately, I have some good news in that we can offer you some local anesthesia to help with pain control. Are you interested in hearing more?
Yeah, let's hear more, Doc.
Great. So some of the benefits of this block are you may get pain relief, you may require decreased doses of IV pain medication, and it might help your breathing. Some of the risks are bleeding, damage to surrounding structures, infection, and in rare cases, pneumothorax, meaning collapsed lung, or hemothorax, meaning bleeding in the thoracic cavity. Would you be okay with us performing this procedure today?
Let's go for it.
All right. Now have you sign this consent form before moving on?
All right.
After obtaining consent, then we're going to gather our equipment for the procedure. You need to make sure you have something to clean the patient's skin, such as ChloraPrep. The anesthetic, and in this institution, we'll most commonly use bupivacaine 0.5%. And take note of the max dosing for your patient's weight. The max dose should be 2 mg per kg, and in this 70 kilo patient, no more than 28 milliliters of 0.5% bupivacaine. Then you need to obtain a syringe and needle for the skin wheel. Make sure you have a large syringe for the anesthetic and saline if you choose to mix the two. You will likely need a spinal needle, and then for the end of the procedure, a Band-Aid or a piece of gauze. As options, you might choose to put a Tegaderm over the and use sterile. Intralipid must be readily available when performing any nerve block. Our ED nerve block kit has many of these supplies, including control syringes, vials of normal saline, tubing, and spinal needles. Prior to starting the procedure, you want to make sure your patient has IV access and is on the monitor. Next, you're going to position the patient either in the lateral decubitus position or supine. You want to make sure that the patient is comfortable. You can also have him or her extend their hand above their head. Then you want to position the ultrasound across from where you're going to be doing the procedure so that you can see it. Go ahead and enter your data as a resident as well as the patient's MRN and click Save. The next step is to identify the relevant anatomy on the patient. You want to put your probe in the transverse position on the affected chest wall, about the 4th or 5th intercostal space. And on your ultrasound, you want to identify the latissimus dorsi and the serratus anterior, as well as your ribs and the pleural line. You sanitize or wash your hands. Be sure to apply gloves and call a timeout prior to starting the procedure. Reconfirm your landmarks as well as estimated depth. Clean a wide area with the ChloraPrep. Make a skin wheel where you anticipate the needle insertion site. You may choose to place the spinal needle directly on the end of a 60 cc syringe, or you may choose to use tubing and have an assistant deliver the anesthetic on your behalf. Next, you're going to advance the spinal needle, visualizing the tip at all times. Once you get through the fascial layer above the serratus anterior, you may choose to hydrodissect with saline only if you're using tubing, or just have a saline bupivacaine mix. Hydrodissect that layer with 5 to 10 cc's to ensure you're in the correct place. Then you may proceed with delivering the remaining anesthetic. You want to be sure to obtain an ultrasound clip of your needle in the fascial plane as it's hydrodissecting. After you have delivered all of your anesthetic, in this case 30 cc's of bupivacaine and saline 50-50 mix, remove the needle and properly dispose of all sharps. You may apply a Band-Aid to the site of needle puncture and then reconfirm that you have lung sliding on ultrasound. Finally, be sure to document your procedure in EPIC.